Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. And patience is a virtue, not your patience in your chair, but patience, being patient. And a lot of you guys are trying to rush your phase two. Now, if you've done your phase one properly, you should not need to rush your phase two. Phase two should start once all the teeth are fully in, 7 to 7, second molar to second molar, canines, premolars, everything. All the teeth are fully in. If you do a phase one properly, there shouldn't be any crowding when you come to phase two. If you didn't do it properly, there'll be crowding. Now, I cannot guarantee, even if you created the space, that there might not be an impacted tooth. It still happens. Sometimes that's genetic, right? All we can do is reduce as many barriers as possible to impactions. If it's gonna happen, it's gonna happen. Making space is not gonna fix it always, but it can help a lot of the times. If you do the growth modification in phase one, be it sagittal, AP, little upper jaws, little lower jaws, and you fix that and move things forward and not backwards, you will have a very easy phase two. If you fix things transverse properly, you have to over fix them. You actually need to create spaces. You won't have as much problems in phase two. So we've got transverse, we've got AP and sagittal, and then of course you've got vertical. Obviously fixing any airway issues, any breathing issues, any habit issues, any tongue positioning issues, that has to be fixed. Or you're gonna still have vertical problems in phase two, as well as airway and sleep problems. That might mean you have to send them to the ENT. It might mean they might need surgery. You can't skip over that part. If you skip over that part and just do the ortho, you're gonna have a really pain in the butt phase two, and you're gonna have a lot of relapse, and you're not gonna get the benefits you would have had doing it early. So sometimes you have to put your foot down and say, no, I'm not going to consider phase one ortho until ENT signs off on it and says I can't. If ENT signs off on it and says you can, well, then it's not on you, And then, of course, you got your deep bites, your low angle cases, your hypodivergent cases. That needs to be corrected as well during phase one in order to have an easy breezy phase two. So your phase twos, if you did your phase one right, should be like 6 to 12 months max, and you should not be charging them $5,000. It's not right. Okay. And to be honest, if you did the phase one and you didn't do it properly, then you still shouldn't be charging them $5,000. That's on you for not doing your phase one right. And most of you are not doing your phase ones right. You're underdoing it. You're skipping things. Oh, I'm not going to fix the vertical. No, I'll deal with the class two later in phase two. Why? These parents paid for phase one. Phase one means fixing the bite, fixing the airway, fixing the tongue position, and getting the patient out of trouble so that the phase two is easy breezy. And a lot of times, if you do the phase one properly, you will not need a phase two, and need is in air quotes, because a premolar might come in rotated, or a second molar might come in rotated, or a canine might come in a little bit rotated. Even if you create space, sometimes they don't come in super straight. They're a little bit tipped or rotated, or, one's higher or lower than the other. So the need is cosmetic only. And they probably would be fine not doing phase two. It would look great. It just isn't like Hollywood perfect. So gray area, it definitely doesn't have to be done at 12 or 13. They can do it as an adult. Maybe you can do it with an alternative aligner brand or a super fast IDV. Usually aligners are going to be faster in phase two. So I try to encourage them because I can see them in 4 appointments, So if we do braces, it's going to be 12 to 15 appointments. Of course, I'm going to charge more for braces. So all right, hopefully that was enlightening. Thank you.